Good morning, everyone. Thank you so much for joining us, and my apologies for if anyone saw kind of the behind the scenes technical glitches all over the place, but thank you all for joining us. My name is Robin Bussey, and I am the Community Health Strategist for Archie, and welcome to the Partnership for Southern Equity Just Health Circle 2 Georgia's Initiative webinar series, Health Equity, the Urgency of Now. This is our third installment, Economic Inequity, the Urgency of Closing the Gap. The purpose of this series is to bring awareness to, educate, galvanize, and organize to take steps to mitigate and eradicate health inequity, including one of the primary contributors that we will be discussing today, economic inequity and the racial wealth gap. But before we continue, as we continue to gather in this space, I really want us to all be mindful and hold space for all of those who have been affected by and who've lost their lives to COVID-19, the ongoing killing of unarmed Black and brown people and racial unrest, either by police and state-sanctioned violence, and again, all of those who are currently being affected by the hurricane on the Gulf Coast. So just take a moment to really hold space for all those being affected at this time. So on behalf of the Just Health Circle 2 Georgia's Initiative and our sponsoring partners, we thank you again for joining us today, and we're looking forward to a dynamic conversation. Please use the chat function for any questions and comments. Please, we want you to limit your questions and comments to that space instead of the Q&A portal so that we can be better able to monitor those and be able to lift those up to our panelists when the time comes. So without further delay, I will introduce our moderator for this morning. She is Maria Thacker Goethe. She is the Executive Director of the Global Health Alliance. She has over 14 years of experience in nonprofit management and development. In addition, she is the CEO for the new Atlanta-based Center for Global Health Innovation. She has a diverse background, including environmental health, women's health, and health communications and marketing. She continues to serve as president and CEO for Georgia Bio, the state's life sciences trade association. Maria received her master's in public health and health education communication and maternal and child health from Tulane School of Public Health and Tropical Medicine, and her Bachelor of Arts in Environmental Studies from Sweetbriar College. Maria is a board member of the CJD Foundation, the Southeast Life Sciences Association, and KSU Research Foundation. And she is the vice chair for the Council of State Bioscience Associations. So without further ado, I will turn it over to Maria. Thank you all.
Thank you, Robin, and thank you for those kind remarks. It is wonderful to be here this morning with you and the esteemed panel that we have lined up. So welcome, everybody. We're very excited for this next installment. And I look forward to diving right in. So today's topic definitely hits home. As a native Atlantan, and Atlanta being for the second year in a row ranked by Bloomberg as one of the most unequal city for the second year in a row, it definitely hits home. So I'm really looking forward to this conversation and personally learning a lot here. Economic disparities and lack of opportunities continue to create a vicious cycle of an inequality, frustration, and discontent across generations. This exacerbates the risks of divisions and hampers in economic and social development. So I think we'll be diving into a lot of these topics in this conversation today. So without further ado, I'd like to introduce our first speaker, Marilyn Nguyen. Marilyn, formerly incarcerated, co-founder and executive director of Women on the Rise, a grassroots organization led by formerly incarcerated women of color to reduce the number of women under correctional control in the state of Georgia. She is a JL USA 2016 fellow, co-chair of the Reimagining ACDC City of Atlanta Task Force to close and repurpose the Atlanta City Detention Center. She serves on the board of directors of First Step Staffing of Atlanta, Cervedas, co-chair of board of directors of 9 to 5 Atlanta Women Network. She received the first Lilly Ledbetter Award, has initiated history-making Ban the Box campaign in Georgia as well. She has been instrumental in President Obama issuing an executive order to ban the box on federal employment applications. In collaboration with Solutions Not Punishment, instrumental in passing In collaboration with Solutions Not Punishment, she was instrumental in passing legislation in the City of Atlanta and Fulton County to implement a 2-year pilot program called the Atlanta-Fulton County Pre-Arrest Diversion Initiative. She's also been instrumental in winning history-making legislation to reclassify marijuana legislation to a non-arrest offense for less than an ounce of marijuana with a minimum fine of $75 and in the City of Atlanta, which just, and in the City of Atlanta recently in collaboration with key players won bail reform legislation. So please allow me to welcome Marilyn Nguyen, and we look forward to hearing from her. So Marilyn, can you tell us a little bit more about your amazing experience in leadership when it comes to economic inequity, systemic racism, discrimination, et cetera? This is an opportunity for panelists to really just tell their stories. So we really want to hear from you, and hope you can tell us what would have been and could have been helpful for you. Your knowledge is definitely welcome. So Marilyn?
Okay, thank you and good morning. I'm more humbled to be a part of this panel and to share my story. And as being formerly incarcerated, I guess you would know I have experienced economic inequality, systemic racism, and discrimination in all the whole package that come along with that. Being born, and I am the executive director of Women on the Rise, of course, and being born and raised in Atlanta, Georgia, 2 streets over from Dr. Martin Luther King in Old Folk Ward area. During the time I was born, I think where I was born was the first rural area or the first hood ghetto of, they used to call it Buttermilk Bottom during that time. So I was born into a family that was poor, and I learned how to shoplift from a kid. I found myself in prison at the age of 17, and I said I would never, ever come back here again. But that didn't happen for me. When I came out of prison, I thought that I would be able to get one of the prestige jobs like my friends did, post office, the City of Atlanta, Atlanta Housing. That wasn't possible. I was Black, I had been in prison, I had a record, and I was a woman. So that's where my life spiraled. It went down and start spiraling down into a life of crime. I actually have served 6 prison sentences. And I have close to maybe 50 arrests. And that happened because of my color, because I had committed a crime, and people just didn't believe in second chances. So that's where all the discrimination, and all of this stuff began. I've had 18 jobs. I had to lie to get those jobs. I was terminated from all 18. So that threw me back and forth into a life of crime. And I actually made up my mind that if I were ever to get the opportunity to make a difference, I would do that. So on my last arrest, that was in 2007, I had a dialogue in the courtroom with the judge that was trying to sentence me for the 7th time to prison. I said, no, I'm just not going back. It's not, it's humiliating standing before you with people sniggling in my back, talking to you about a crime I committed that I feel now and know now that I was forced to commit by society when they will not allow us to get jobs, get education, have housing, do none of those things, even if you just go to jail now for I would say anybody can go for a traffic violation. That is what is held in the city jail. So we had this dialogue, and what I came to find is that the reason I was going is because they didn't have anything in place for me. If I didn't have AIDS or if I was not a drug user, then there was not a program for a person that just wanted to live and have, I would say live and have the things that we say that our human rights to have things, housing, jobs, and all those things. That wasn't for me. So the judge and I had this dialogue, and he said, well, I don't know what to do with you. He said, but I'm not going to send you back to prison. You're right. Because if I come back, I'm going to do the same thing. And he said, you're right. If you come back, you're going to do the same thing. So he did not send me back, but he sent me to Fulton County Accountability Court. And that's where I never looked back. I took that and was able to get a job where I can say I'm formerly incarcerated. So that's how I got to where I am today. But I have experienced all of those things. And people that are formerly incarcerated, people that are uneducated, people that are Black, brown people are continuously, as we see today, not just in the 60s when in the early 50s when I was born, even today, we're still fighting for the same thing that Martin Luther King fought for, John Lewis fought for. We are still fighting for our human rights. And to bring this into content, and I feel now is the time that our young people are now understanding what our ancestors was fighting for, and they're now picking up the torch. I feel that it is a time now that for us to regain our heritage, regain our human rights, regain our dignity, our integrity, and all of the things that we deserve. Yeah.
Wonderful. Thank you. And I think I'm right in saying amen to all of what you just said. And congratulations on, working through and achieving and persevering through everything you've been through in your life. Really appreciate you sharing your experience, Marilyn. So
No, go ahead.
So, no, it's fine. I was, thank you again. So we're going to now transition to a broader panel discussion, and Marilyn will be joining us for this. And I'd like to just remind everyone to please submit any questions you may have for Marilyn and the other panelists in the chat feature of the webinar. I don't believe we've gotten any in just yet, Robin, but it looks like we're good. So just a reminder to make sure to submit any questions for our esteemed panelists. So moving on to our panel discussion, I'd like to first kick off by introducing our panelists. So we now have joining Marilyn, Sandra K. Barnhill, who is founder and CEO of Foreverfamily. She's an attorney and has been an activist and national advocate for prisoners, their children, and family members, and a champion for reentry services that provide comprehensive support to prisoners so they can successfully reunite with their families and reintegrate back into the community. Also, we have Erin Hernandez joining us. Erin is President and CEO for the Northwest Georgia Regional Cancer Coalition. Erin serves as President and CEO of the Cancer Coalition, and she brings more than 20 years of experience in health education, cancer control research, grant management, and community health program development into her role. She's responsible for local, state, and national government relations, program fund development, planning, marketing, and overall strategic direction of the organization. You wear many hats, Erin, and I can relate to that. Also, we're very pleased to have Ray Khalfani with us. He is a research associate with the Georgia Budget and Policy Institute. Ray's work focuses on policy arenas within GBPI's safety net portfolio, including unemployment insurance, TANF, and SNAP. He also handles strategic communication and advocacy for its workforce development campaign in Prosper, Georgia. Prior to this role with GBPI, he was a graduate research fellow with the Southern Economic Advancement Project, and he was studying intersectionality of economic development and rural serving transportation programs. And then, of course, we have Marilyn. And with that, I'd like to open this up and ask everybody on this panel, really, given where we are at this time, can you tell us, in the context of the throes of the pandemic and ongoing debate about extending economic benefits, post-George Floyd, school openings, and ending the evictions moratoria, what are you seeing in terms of economic equity from where you sit? And I believe I will ask Ray to kick us off with this. I think he's short on time. So Ray?
Yes, thank you. Good morning, everyone. Yes, I'm Ray Khalfani. I'm a research associate with the Georgia Budget and Policy Institute, and I'm thankful for the opportunity today to have a conversation about where we are, in terms of racial and economic inequity and where we go from here. There's so many topics that, that I could dive into, but I'd like to open the conversation on 3 topics. One is unemployment, 2, workforce development, and the 3rd is healthcare access. So let's get into that. I'm going to start off just with a couple of catching visuals that I wanted to show you guys is I began talking about, the first topic, which is unemployment. And hopefully everyone can see my screen from here. Nod your head if you can see my screen. Okay, cool. So with that, we're talking about the racial wealth gap and economic inequities and the path forward. When we talk about unemployment, I'm talking about more specifically, unemployment, the labor force, and how we engage on this topic moving forward. And then even more specifically is, the data that's left out of this discussion. We're most familiar, or the common metric that we're used to hearing about is unemployment, the unemployment rate. So I'll start from there. So in just looking at trends in Georgia when it comes to the unemployment rate between people of color and white workers.
My apologies, Ray. I just want to make sure that people can see your screen. I don't see anything. So Robin, are you showing it just to the attendees, or are you showing it, Ray? I apologize to interrupt. You can't see anything?
No.
Ray, can you hit share screen again at the bottom of your?
Yeah, at the bottom of your screen, it should see a share screen button. I think it's green typically.
I thought I did. Sorry.
Yeah, and then you may have to actually select the screen once it pops when you hit it. Okay. Yeah, no worries. Sorry, I thought it was just a panel view. There we go. All right.
Good. Okay. All right.
You're good to go now, sir. Thank you.
I'll wind back a little bit. So, when I'm talking about this topic of unemployment, I'm talking about more specifically unemployment, the labor force, and how we engage on this topic moving forward, and the data that's often left out of this discussion. The labor market measure that we're used to hearing about is the unemployment rate. And when we're talking about, and just talking about the unemployment rate and the disparities that exist in Georgia, this visual here shows from the pre-Great Recession all the way up into 2019. So 2007 all the way up into 2019. And we see, throughout this entire period that Black unemployment was double the rate of white unemployment, and at times almost triple the rate of white unemployment. Then even as we get to 2019, where we had, achieved, a good deal of recovery, this unemployment rate between Black and white workers is still, the Black unemployment rate is twice that of their white counterparts. The other common measure that we look at, and and another eye-popping visual that I want to show you guys is the gap that we have between unemployment insurance filings. What we have here, and I know some of the writing and the legend may be small, but the main thing to pay attention to is this blue and orange coloring that you see. This starts in 2007 all the way up until now. The blue portion represents the period starting in 2007, before the recession, where Black unemployment insurance filings were higher than white unemployment insurance filings. We were over as we've been almost the entire period, and particularly during periods that don't have a recession, unemployment insurance filings are significantly higher amongst Black workers than they are with white workers. We're overrepresented when it comes to that. While we share, maybe a 30%, 31% share of the workforce in Georgia, we're oftentimes, above 50% when it comes to the share of unemployment insurance filings. So the blue portion you see in the beginning, that's when we have a higher share of unemployment insurance filings. Well, as we go into the orange portion, this is where we get to the peak of the Great Recession period, where unemployment insurance filings among white workers, now they begin to be drastically higher than Black unemployment insurance filings. And this is the trend that we're seeing that's playing out again in this recession here, where as you move forward in time, we going into 2011 all the way to 2019, we're seeing that Black unemployment insurance filings, they're higher once again. They're overrepresented in the amount of filings that are there, and they're higher than white filings. And this next, that at the end, all the way at the end of the right, you see this long orange streak. That's a streak where in April 2020, where the same trend that happened in the peak of the Great Recession happened here, where white unemployment insurance filers were drastically higher than black unemployment insurance filers. And then just 1 month later, in May, black unemployment insurance filers took the lead once again. And then in June into July, the gap just skyrocketed, and you see, how tall that blue line and blue streak is. And now in these last couple of months compared to what it was in any other point earlier, all the way back to 2007, the gap that's here is way beyond what we've ever seen when you talk about a gap in unemployment insurance filings. Just to put some numbers to that, in May, once black unemployment insurance filings began to overtake white unemployment insurance filings again, black filers were 10% higher than white filers. In June, they were 22% higher than white filers. And then in July, they were 34% higher than white filers. So this gap is growing and growing and growing when we talk about unemployment insurance filings, showing that, we're taking the heaviest brunt when it comes to, the loss of jobs in Georgia. Now, these two metrics I just mentioned, unemployment rate and unemployment insurance filings, this is common. This is what we normally hear. I mean, some of this data may be new to some people, but we're used to hearing about, when we're talking about measures of the labor force, labor market, we're used to hearing about unemployment rate, and we're used to hearing about, the level of unemployment insurance filings. What we don't hear enough about is other labor force data that matters. And that, there's, a puzzle, I guess you could say, that, all of these different metrics, should be placed in together. We should talk about this stuff collectively, not just talking about unemployment rate, not just talking about unemployment insurance filings, but things such as an employment to population ratio, which, simply would be, what's the amount of employed people in a particular population. This eye-catching visual I have here is, it starts from the recovery period after the Great Recession in 2011, all the way up until now. And we see that the employment to population ratio, it took nearly 10 years to get to a point to where it's close to 60%, to where it is in the same range, you could say, as that of the white employment to population ratio, which is typically higher than 60%. Once in April and March and April, when this pandemic and the recession hit here, the employment to population ratio dropped over 10 points when it comes to 10 percentage points when it comes to black workers, where, at one point just a few months ago, less than half of black America had a job. Right now, we stand at 51.5%. So just barely over half of black people in America have a job. Now, I don't have figures on what it is in Georgia at the moment. And I'll get into that a little bit later as far as why I don't. That's going to be part of one of my policy recommendations. But this is a metric that's not talked about enough, because it, unemployment rate tells you one thing, it's important, but there are other metrics that provide a whole as far as what we need to see when we're talking about labor market health. The other thing that's not mentioned enough is underemployment. And here I'm talking, I have a visual that specifically talks about underemployment in Georgia amongst black workers. And underemployment is oftentimes double the rate of the unemployment rate. So the underemployment rate, unemployment rate right now for black workers nationwide is about a little bit over 15%. We expect it to be, the underemployment rate to be double of that. For almost every year in Georgia, from 2007 all the way to 2019, you see an unemployment rate in, 2007 is 8%. The underemployment rate is 12%. And, why does underemployment matter so much? Underemployed workers who are also disproportionately represented by people of color often receive few benefits, limited paid leave, unstable work hours and schedules, and face restricted paths of advancement or career growth. These conditions are dually harmful because, they not only affect the economic security and mobility of families of color and all the other, families that experience underemployment, but they also limit the growth of the economy. When you're underemployed, You know, and let me make sure I give a definition of underemployment. Underemployment is when you have to take part-time work or less than full-time work because of economic reasons. And, you know, in this recession, it's not just about the people who have lost jobs and how that's reflected in, you know, people who lost jobs and are still looking. That's the unemployment rate. But it's also about people who have lost hours, who have lost wages, who still have jobs, but you know, we're overrepresented amongst that portion as well. We're not just overrepresented when it comes to unemployment, we're overrepresented when it comes to underemployment. And what that does for us in trying to move up the ladder, you know, in a job that you have, trying to put food on the table, and even for those who get, you know, more than one job because one part-time job won't do, they're often not in a, it often doesn't put them in a better economic situation because, you know, there's that second job that, you know, that's a part-time job can oftentimes be, you know, a job that has these same type of work conditions where you have few benefits, unstable hours, unstable schedules, you know, you have limited paid leave, you're not able to, you know, to take care of, you know, certain personal or family issues, you know, to the degree that you would want to because of these type of, you know, unstable work conditions. So, you know, this is another metric that's not talked about enough, and it has to become, you know, part of conversation. You know, when we're talking about the health of the labor market, these other metrics matter. And one other thing I don't have a visual for, but it's also the other metric that matters is, you know, the labor force participation rate, which talks about everyone who's employed and everyone who, well, let me say it, I want to make sure I say this clearly. And forgive me if I'm talking about, you know, I'm providing definitions that you guys already know, but, you know, for anyone who doesn't, you know, who's not familiar with this, you know, labor force participation rate includes everyone who's working, everyone who's not working, and who is still looking for a job. And by showing, you know, the measures of who is still out here working and who's out here, who's unemployed but still looking, it shines a light on those who are not looking for jobs anymore. Because that's one of the biggest things that's taking place right now in this recession that makes this, you know, unique compared to the, you know, to the Great Recession, the recession, you know, 10 years ago, is that there's so many more people who are long-term unemployed and so many people who are just giving up looking for work altogether. You know, these are people who, you know, have to take care of, you know, the health of their loved ones, health of themselves, who are scared to go out and get a job because, you know, of the risks that are there, you know, and as Georgia, you know, we recently passed a law, you know, as far as corporate immunity, where there's very little, if no protection for workers who are exposed to coronavirus. And, you know, employers who, you know, don't, you know, follow or don't provide, you know, many safety precautions for their workers, you know, there's very little recourse for someone to be able to, you know, file a lawsuit against them because, you know, you'd have to find them as, you know, grossly negligent. And that is, you know, the threshold to meet gross negligence is so high, it's almost impossible. So there's pretty much, you know, there's no protection for workers in Georgia and many other states who have passed corporate immunity laws to protect employers from responsibility in protecting and securing the safety of their workers. Going from there, and just want to give just a few other data points before I transition to workforce development. You know, the white employment to population ratio nationally right now is 64%, or at least as of July. In July, the black, I said, you know, for black, the employment population ratio is 51.5%, and for the Latinx community nationwide, it's 56.3%. So, as I was saying, you know, you see this visual that I'm showing you. We have to talk about, you know, these measures collectively. Now, and from there, I'll go into its policy recommendations that I have for that. You know, two things. You know, as I've been saying, you know, as I've said multiple times, you know, across our community spaces with each other, across the legislators, you know, state and federal agencies, you know, there needs to be a holistic discussion of our labor market measures, and they must be universally provided and provided, you know, within a time frame that, you know, right now, you know, we can get, you know, labor force data that's disaggregated by race, ethnicity, gender. We can get that on a federal level, you know, month to month, but we cannot get that currently on a state level every month. We can get it every year, But this is something that needs to be provided, much more frequently. It needs to be talked about, much more commonly in every policy space that we have, because if we're going to close these gaps and we're going to look at and pay attention and make these gaps, available to the public to see, to make ourselves accountable to these gaps that are there, this has to be part of our everyday policy conversation when we're talking about labor market measures. Transitioning into workforce development, which is the next part. As I said, there's so many people who are no longer looking for work. They're scared to go back to work. There's a number of reasons why they can't. But eventually, when the economy recovers, they're going to want to go back to work. But the issue that they're going to run into, that's what happens, when you're out of the labor market for long stretches of time, is that you have erosions, in your skill set. There's erosions in your social and professional networks, which make it that much more harder for you to get back into the labor force. With that being, I'm going to show my face again. But from there, when we talk about getting back into the labor force and what we must do to intentionally close these gaps, that are there, there has to be workforce development policy that intentionally creates that. It intentionally brings people to a place where we are retraining and retooling workers to be able to get back into the workforce. Along with the workforce among people of color that includes occupations with a career track that has a 4-year degree or higher, there's a large part of our labor market that consists of middle skill jobs, which require education beyond high school, but not a 4-year degree. And there are too few workers who can access the skills, the training, and the education to get these middle skill jobs that, are gonna come, as our economy, begins to recover and improve. Decades of intentional structural racist policies have created and perpetuated racial equity gaps in educational attainment, employment, and income. And as the economy recovers and brings demand for this new wave of middle skill jobs, we must have these workforce policies that are intentional in correcting the disparities in this educational attainment, employment, and income. So my recommendation for that, there's so many, but in the arm of GBPI that I'm also when we talk about Prosper Georgia, one of the many policy recommendations that we have is that there needs to be a statewide apprenticeship program in Georgia. And along with that, there should be pre-apprenticeship and pre-employment programs, that couple that. And these programs can be especially valuable for people of color who have been historically underrepresented in certain industries. These programs can help workers acquire a basic level of industry relevant skills, and ultimately prepare them for apprenticeships and jobs. They can expose workers to job sites, environments, and they can provide support for workers to address barriers like childcare and transportation, which so many of us have when you talk about barriers to getting into keeping a job and to getting a job. And most importantly, these apprenticeship programs or pre-apprenticeship programs, they can create formal access points and relationships with employers instead of forcing workers to rely on their own professional networks and social networks, which can erode over time. And just as I talked about when I talk about disaggregating labor market measures like unemployment rate, underemployment rate, labor force participation rate, and employment to population ratio, policymakers also need to require disaggregated data on race, ethnicity, and gender for the programs that are, for the pre-apprenticeship and apprenticeship programs that will be serving people of color. That way they can target our investments in these organizations and make sure that have a demonstrated track record of effectiveness in serving people of color. The last topic I'm going to go into that is intertwined in all of this is healthcare access. And I'm talking about Medicaid specifically. And when we talk about Medicaid, quite simply, when people lose jobs, they lose income, when they lose wages, more of them become eligible for Medicaid. And Medicaid enrollment and the enrollment for Medicaid, it kind of lags behind, people signing up for unemployment insurance or SNAP, food stamps, just because, people, when they lose their jobs, when they lose wages, they focus on the most urgent needs first. food and rent. And then also some people don't lose their health coverage immediately, when they lose a job. So that, can push the lag, that can make the lag in Medicaid enrollment, a little further behind, unemployment insurance or, other type of public assistance, within the safety net. But, eventually it's going to grow. So far, the federal government under the CARES Act has, helped preserve, state Medicaid budgets, but that's not going to last forever. When, under the CARES Act, the federal matching portion, they, increased that to 6.2%. So, and that covers, a particular portion of the state Medicaid budget to be able to cover this increased, public need, for those who enroll and use Medicaid. So, as you expect, my recommendation for this, when we talk about another thing that can help close these racial gaps, in equity, is Georgia must expand Medicaid. Nationwide, an estimated 4 million people will become eligible for Medicaid if it was expanded by the remaining states, which includes 650 uninsured essential or frontline workers who are overrepresented by Black and brown workers. And this number is going to likely increase as this recession continues. Shows you, talked about the metrics as far as, just how many people are, becoming long-term unemployed or just, getting out of the job market altogether right now. And if that continues to increase, there's going to be more people eligible and who apply for Medicaid. Expansion would help narrow the racial and ethnic disparities in both health coverage and access to care, putting Georgia in a better position to respond to higher COVID-19 infection and mortality rates that Black, Latinx, and other communities of color are experiencing. In expansion states, only 17% of low-income workers are uninsured, compared to states like Georgia, who have, up to 30 or more % of low-income workers being uninsured and not being protected, in a case of where they would need, healthcare the most. By providing health coverage for people who lose their jobs or experience sharp drops in their income, expansion can help prevent this recession from widening racial gaps and access to coverage and care like the Great Recession. Before, Medicaid expansion was there. Medicaid expansion is also a powerful anti-poverty tool. It helps reduce medical debt of low-income Americans, which plagues so many. It improves people's access to credit and significantly reduces housing evictions for renters, which, we know, this is another big crisis that's happening right now where, the moratorium when it comes to rent, that's been lifted. You have so many people who are at threat of losing, the stability, of their homes. And, some are on these margins where, if they didn't have, certain medical debts, if they didn't have to use so much of their income to pay for health coverage, they may be able to be in a better position when it comes to avoiding eviction. People of color make up a disproportionate share of those who can gain coverage through expansion, compared to the share of the population across remaining non-expansion states. People of color they're disproportionately likely to reside in states that have not expanded Medicaid. So, expansion can help keep the recession from worsening health disparities. There's clear evidence that COVID-19 recession is already hitting people with low incomes of color really hard. More than half of adults in lower income households, and 44% of Black and 61% of Hispanic adults say they or someone in their household has lost a job or taken a pay cut due to COVID-19. And just to give a couple of just other statistics before I stop the conversation. That uninsured parents who will become eligible for Medicaid coverage is 123,000 in Georgia. Uninsured people who working in an essential job or in a frontline industry who will become eligible for Medicaid coverage if Georgia expanded, 62,000. And I'm sorry, it's one other thing I wanted to mention when I'm talking about unemployment in this debate, because I can't leave without saying this. This debate is there as far as, people are disincentivized to work if they, because of the the $600 enhanced unemployment benefit that the federal government was providing on that stopped July 31st. But this argument saying that people, are disincentivized to work, research has shown time and time again that that's not true. Just aside from research, just from, by default, the way that unemployment insurance works, if you're turning down suitable work, just to keep your unemployment benefit, you're threatening, losing that, because, part of, you receiving unemployment benefits stipulates that you must be actively looking for work, even though that part has been taken off. But if you're taken off temporarily, but if you are receiving, work offers, for suitable work, if you turn that down, you're more than likely going to lose your unemployment insurance. Along with that, and just saying this simply, one bit of empirical research is out there, says that, this thought process that if you're in a state that has, for lack of a better word, is really stingy when it comes to unemployment benefits, like the state portion, not the $600 portion part, but the state portion, like Georgia, which is stingy. Georgia averages about $255 a week in the state unemployment portion. And, empirical research looked at, okay, if people in stingy states are being, compared to states that are not so stingy, they might offer $400 to $500 a week in unemployment pay. If these stingy states have people getting job offers again, then more of them are going to go back to work than those states that are giving a lot more unemployment pay. The part that's not $600. I mean, just thinking, okay, if you're getting less money in unemployment and you get a job offer, there's more people that are likely to take that job offer if you're getting stingy pay. But research has shown that that's not true. There's no significant difference between those in states that have stingy unemployment benefits compared to states that have more generous unemployment benefits. If this argument that says, people who are disincentivized to work because they're getting so much money from unemployment, if that was true, then in these stingy states, more people will go back to work than those in states that are not so stingy. But that's just not the case. Another thing, when we talk about, give me out of, brain freeze, but when we talk about, it's gonna come. I'm on a roll, and that just slipped out of my mind just like that. But it's gonna come to me. But when we talk about, when we talk about the value of a job and what you get from a job compared to what people get in unemployment, this enhanced unemployment pay, the value, the research that says that unemployment pay is more valuable than a job, that's not true. In the sense that they're not taking the total value of a job, not just the wages that you earn, but the paid leave, the employer-sponsored health care that you receive from a job, the retirement benefits that you receive from a job, and other benefits that could come with that, and just the dignity of work. That the value of that monetarily is greater than what 60% of people who will receive this enhanced unemployment pay, the value of their jobs altogether, when everything I've just described, is higher than the value of this unemployment pay that they've been getting, $600 a week added to their state unemployment portion. And then for the 40% whose unemployment portion is higher than their, the value of the wages and the non-wage portion of their jobs, that 40% whose unemployment benefits are higher, a good portion of them are underemployed. And the question needs to be flipped and saying, why should people who are getting low, most of these people are unemployed, who are overrepresented by people of color, why should they be returning to a job with, incredibly low wages? They're not being protected, in their places of work, and risk their lives, risk their livelihood and that of their families for pay that's so much lower than what they're getting in unemployment insurance benefits. What we should be thinking about is, why are we not paying them more? Because these are people often in frontline industries that are doing the things that keep our economy going. And if we're not taking care of them and saying, hey, you're on your own, we're not going to protect you. Your employer says, hey, we're going to you're up to you're on your own when it comes to taking care of yourself and protecting yourself from coronavirus. And there's very little recourse you can get from that. That's what we're saying, you know, which is what's being said by those who are, you know, basically making this argument. And there's a, you know, a racial tinge behind this that goes back, you know, many, many decades. It's not simply about, you know, it's not simply about, you know, people, you know, being disincentivized. It's disincentivized. It's about the fact that, you know, people of color, you know, are those who are, you know, disproportionately affected by this, who may be disproportionately, you know, receiving, you know, this enhanced unemployment pay. And we don't want them to have it. So I'm going to stop there. I know I've taken a lot of time. I apologize, but I'm going to pass it.
No, Ray. Yeah, Ray, thank you. I think that really helps set the tone, the data, and your presentation did. And I think it's, you know, honestly, the data is more troubling than when you see it so comprehensive and see all the pieces of it, just like you alluded to. I mean, so often we don't get that type of transparency. So I really appreciate that. And I'm sure everyone on this event right now appreciate that as well. So thank you. And I will also add, you know, we have a STEM Institute, the center, and there are companies needing people trained, and they're starting up apprenticeship programs because the workforce programs are not there. And I think there is a need on the employer side. So there's a huge opportunity to work with even our own industries here in Georgia that are willing to train people up, even those straight out of high school or without a high school even degree, to bring them, get them the skill set they need to get jobs. So there are opportunities. It's really connecting the dots and educating and advocating for things like everything you just alluded to. So thank you, Ray. And again, I really think you set the tone. So I kind of want to make sure we allow time for the other speakers to also comment on this. And open up to some more conversations. Also, thank you everyone for your questions. We do have them coming in, and the team is trying to answer them to the best of their ability. Ray, lots of questions for you, but we will be getting to the questions and answers after we get through, allow the other panelists to give some remarks. So again, I'm going to pivot to, who do I have next on my list? Apologies, too many screens open. So I'm going to ask Erin to chime in here. So given where we're at this time, same question, what are you seeing in terms of growing economic inequity from where you sit, you know, and I think you have the other questions, but for the audience sake, you know, what is critical to close the economic inequity gap, and what can community members and stakeholders do? And of course, what policy recommendations do you have? So Erin?
Sure. Well, let me just start by telling you a little bit more about the Cancer Coalition and the work we do, because I think that kind of helps shape the context for which I come to you. I've been with the Cancer Coalition since 2013. Prior to that, I worked as a health education and special projects subcontractor for the Cancer Coalition when I was with the AHEC network. And before that, I served as a medical librarian for both physicians and community members in a local hospital. So I have been connecting people to resources collaboratively for a very long time. So that is my background and how I come to you today. The Cancer Coalition serves 18 counties in Northwest Georgia. We provide information and services in the area of cancer awareness, prevention and education, screening assistance, research facilitation, policy advocacy work, and then survivorship support. So mostly what we do is really try to help support the uninsured and underinsured, understand the importance of early screening and detection, and then, you know, how to access services. And then we also provide for those services when needed with our service partners. Last year, we provided about 1,000 free screenings, mammograms, pap smears, colorectal cancer screenings, lung cancer screenings, as well as prostate cancer screenings. And then we also work with a few sister organizations here that support patients while they're going through their cancer journey with different special funding programs that we have. So what I wanted to draw your attention to today is cancer patients and how we're seeing their economic disparity right now. Many times we think that, you know, we know that health disparity exists, but we think of it as kind of a long-term problem, right? You know, generational poverty, and in other circumstances that may put someone in a somewhat marginalized population. However, many of us are living paycheck to paycheck, and any type of financial challenge that crops up will kind of throw us into a true financial crisis. And this is especially true with cancer diagnoses. Many times, the person who is diagnosed with cancer may be the sole provider for their family, or maybe while they're undergoing treatment, they can no longer work, and they certainly are part of the contributor to a family's budget. Another thing is right now, during time of COVID, you know, our cancer patients are more and more isolated. So some of those barriers, such as getting to treatment with transportation, in the past, they could have relied on friends and family to take them. That is no longer an option right now. So just a lot of barriers that may have been somewhat more overcomable in the past. Right now, we're not. And another thing that we're really seeing that's been really eye-opening for us is the increase in homelessness among cancer patients. Again, with job losses, many of our homeless shelters are already at capacity. Around here, we have about a 6-month waiting period for people to find housing. And so we are actually kind of using some of our collaborative efforts in the community and some special funding projects to actually try to prevent eviction to begin with, because it's a lot cheaper to pay their rent than it is to try to house them somewhere for 6 months until somewhere in the shelter becomes available. And just a few facts I wanted to share with you about the cost of cancer care. Newly approved drugs cost an average of about $10,000 per month. 11 of 12 of the FDA approved drugs cost over $100,000 a year. In 2017, cancer patients in the United States paid about $4 billion in out-of-pocket expenses for cancer care. Cancer patients are 2 times as likely to declare bankruptcy as healthy people. And about 80% of those that do die from their cancer diagnoses. And, you know, that is due to, if they've already declared bankruptcy, they're already having financial challenges. If they have, if their cancer comes back and they do not have, you know, the money or the insurance or anything like that to pay for their treatment, and many go untreated. So cancer does not discriminate. We know it's a disease that affects all of us. However, access to care and treatment is a totally different matter, excuse me. And we've also been doing some research in our area just to kind of, if for those of you in the healthcare space, something to be on the lookout for, in researching our delinquent screening population. So those who are due for screening that have not come, and we've started reaching out to them to remind them of their annual screenings. About 30% are reporting being afraid to come in for screening. So that's a message that we're really working on locally. And then another 30% just are not reachable or responding to calls. And we know that some of it is transient population. They may have lost jobs. They may not have phone service. They may be located in a different area than they were before. So we really expect an uptick in the later stage cancer diagnoses this year, and are really working to get people in, get the message out that perhaps, you know, our healthcare facilities right now may be the safest place to be, and to come on and get those screenings. And as far as what's critical to closing the economic equity gap and what community members can do, I think for us, the secret sauce has really been collaboration and collective impact. I mean, we by no means have solved the issue, but I think that we have found some strategies that are working for our communities. Here, for instance, we have a trio of organizations, and we kind of assist cancer patients at different stages of their journey. So like we identify them as being underinsured or uninsured and need screening. We have Cancer Navigators, which actually kind of sees patients through their journey. And then we have another organization that actually serves the children of children in families with cancer, and also serves their families as kind of an ongoing support group and survivorship. And we really make sure that we work in tandem, that we share resources, and we just really want to make use of every available dollar. And then we also work with, we are the recipients for the Two Georges program, where we have collaborative community health improvement projects. And we have found that that collective impact is far more effective and far reaching when the county's resources were just all working in isolation. For instance, when we first got there, you know, you had many people doing great things, but they were kind of doing their isolation. They weren't sharing resources. People who entered the system in one place didn't necessarily end up where they needed, or this resource that might be available over here. So we feel like providing that collective impact really increases the amount of entry points for people to gain access and the services that they need. And another thing that we do here at the Coalition is we are partnered with our local hospitals. We sit on the cancer committees, and we feel like that helps us to hear what the hospital's priorities are. They have much bigger pocketbooks than we do. We understand what they're doing for communities, what the resources are available. We're able to share with them what we see in the community and what those needs are, and it helps them shape their programs to be better situated for that particular community. And then another thing that I think that's really important is that we educate our clients and our volunteers in everything we do, just because they are our biggest messenger. And telling them and letting them go out and kind of be that billboard and that mouthpiece for us, I think is very, very beneficial. Nobody can do it alone. We all have to work together. And then as far as, figuring out what to do with the racial wealth gap, I personally don't have a lot of experience in working with that, but we do engage a lot with our legislators. And I think that is very, very beneficial and very important to the work that we do. So if you are in that position, something that I would encourage you to do is really, share your story year round. Don't wait till you need them. Be talking to them, share your story, illustrate it, show them, engage them in your communication and your messaging. If you have a newsletter that goes out, make sure your local representatives are on there so they know that the good work that you do. And then when you come to them with your funding needs, also bring them solutions, because everybody is coming to them with needs. And so they really need to understand how it is that they can help you, and they need help finding those solutions sometimes. So that's what I have to share with you today. If you have any questions, let me know. But I think we're all doing great work. I'm excited to hear more.
You're on mute, Maria.
So sorry, I'm on audio with my phone, so I don't lose the connection because of bad bandwidth or anything. So yeah, no, that was great, Erin. It was really good to hear from you on all of that. Being that I work with, biotech and life science companies around the state and a lot of patient groups, I would just second that message of including the messages and your people's narrative and stories to legislators if you really want to get the message out. And I would just add, make it succinct and come with solutions, just like Erin said. Succinctness does help to make sure, because there's a lot coming at them. But so I want to allow Sandra to now give her perspective on the same questions. Let me see. Can you go off video, Sandra? Just want to make sure there you are. So wonderful. So Sandra, same questions to you. I think you have them, so I don't need to review them again. Okay, excellent. So Sandra?
Well, so good morning, everyone. I'd like to do three things. One, I'd like to spend a minute thanking and acknowledging a few people. Two, I'd like to underscore a few things that Marilyn and Ray said, and then I'd like to close out my few little minutes with some actual recommendations. So first, I want to acknowledge the over 100 people who are on this conversation. I think the fact that so many people have joined us really underscores how important this issue for us is right now in our community. And so I want to thank PSE for being willing to have this conversation, for hosting it. Then I want to thank Erin and Ray and Marilyn for being a part of it along with me. So, when I listen to everything that has been said, starting with the powerful way in which Marilyn shared her story and the way the data Ray gave underscored it, I just need to exhale for a moment. That we've heard a lot this morning. It's been deep, it's been impactful, and I need to exhale, because if I did not know that there really are solutions to the quandary we find ourselves in, I might be depressed today. But in exhaling, I'm letting go of all of the things that, if we look at them on the surface, are just deeply troubling and speak deeply to the deeply embedded and systemic racism and marginalization of people in this, particularly people of color in this country. So I want to exhale that, and I want to move to where I feel like Marilyn started this conversation, talking about the resilience, the desire, the willingness to do what it takes, not just Marilyn as an individual, because clearly she spoke to that, but to Marilyn as a member of our society, putting out real solutions. So when I then moved to what Ray talked about, one of the stats he didn't give that I do want to share with you about returned citizens is this: 65 to 70% remain unemployed after their first year of release. My agency, Foreverfamily, has a pretty, for us anyway, we think big vision, which is to see children and families affected by parental incarceration successfully contributing to our society. Our mission is fourfold. The first thing that we want to do is inspire hope in the kids. The second thing that we want to do is to strengthen and support their parents. Kids do better when parents do better. And then for us, the third thing is really trying to make sure that the children become successful adults and the parents who have been affected by incarceration, either their own or a family member or a loved one, are able to do what Marilyn talked about they wanted to do most, which is positively contribute to this society. So the other piece that Marilyn really just hit home for me is when she began sharing her narrative. She said something along the lines of, my family was poor. And what she really brought home for me is, let's get real, folk. Many people in this society are marginalized and distanced from our society long before they become incarcerated. So when we talk about making some changes, one of the number one changes is that we have to make is we've got to deal with the racism in this country, and we have to deal with the gap between the haves and the have-nots. That being said, I do want to focus before I close on three things that I think can make a change in terms of the economic and even the health disparity in our country. So here's the first thing. Because I work in the area of incarceration and reentry, I know that we cannot wait to focus on these things when folk are home. From the minute they get locked up to the day they come home and beyond, we've got to be focusing on these things. So there are three things that we know cause success when someone is either incarcerated or returned. The first thing, I'm going to name the three of them, then I'm going to take just a second to unpack each one of them. The first one is family support. The second one is skill development, training, and employment. And the third thing is what happens in the community in terms of supportive networks. So I've said the three, so I'm going to go back. Family support is key. When someone goes to prison, the people who generally fill in with their children, provide money, put money on the books, do all that stuff, are their family members. And we live in a society that's anti-prisoner, but it's anti-family too. And so one of the things that we've got to do is to create more policies that support the families who are supporting family members who are incarcerated and their children. So it has changed in Georgia, but there was a time in Georgia where someone who took care of children as a foster parent was paid more and provided more support than a family member, right? Georgia's changed that around kinship care, which I think is very important. But we also know from, I think it's about 5 years ago, the Ella Baker Center for Human Rights did a survey around the cost of incarceration and who bears it. And it says in many cases, in addition to the prisoner, the person who has been incarcerated or is incarcerated, their family on the outside. And many of those family members are women, from the moms to the grandmas to the auntie, who are paying court costs, who are helping get a lawyer, who are taking care of the kids. And so we've got to provide more family support. The second issue I raised was skill development, training, and employment. Critical. One of the things that we know that prior to their incarceration, a significant portion of people were not employed. I agree with Ray, there's underemployment, but there's a whole segment of folk who were not employed. And so then they come to prison, and if there is no skill development there, when they are released, they struggle to get a job. The thought used to be that employers did not want to hire people who've been in prison because, oh, they might be violent. And yeah, that's part of it. But what research is showing us is that employers are also concerned because they don't have the adequate skill level to perform the job. So when folk are inside, we have got to begin their skill development. And it needs to be skills, not just skills that pay a minimum wage, but how about a living wage? And then we go to the issue of employment. Marilyn Nguyen, and I'm so honored to be on this panel with this woman and her work with Women on the Rise, was a lead person in getting Governor Deal to ban the box. She is working with the mayor to close the detention centers, but part of those efforts all stem around the fact that we use all of these sanctions, these additional sanctions, what are called collateral sanctions against people so they can't get a job. By that, I mean prisoners, people who have been in prison who are now home are banned from engaging in certain jobs after release. And some of them, you wouldn't believe what they are: driving a bus, being a cosmetologist, getting a real estate license. And so we must begin to tear these sanctions down so that people can become employed. And then the third thing is a community that is supportive and that helps to establish networks. Our community has got to deal with the fact that when people come home, they need all kinds of support: emotional, social, physical. And we also have to deal with the fact that substance abuse is real and mental health issues are real as well. And we need to start providing more support in those ways. One of the things that's very exciting to me now in community, and this comes out of family, is many family members are saying, hey, my relatives comes home, they can't get a job, so let's create a job. So I love the entrepreneurial spirit that is increasing, so that family members and people in community are creating businesses and micro enterprises so that people can be employed. So in closing, I just want to say this: when we talk about what can make this thing different, we got to move from a surveillance model of folk to a support model. And it's going to take that from all of us. And by that, I mean correctional professionals, community folk, release people, family members. We're all in this thing together. And to make a change, it's going to take all of us coming together, working on it. Because what is so very true is that when people come home, they go back primarily to their community. And it's oftentimes a community that's underserved, that's devalued. And if we want to revitalize that, we've got to work alongside them to do it. So thanks for the opportunity.
Oh, there we go. All right. No, thank you, Sandra. That was great. Everyone is so impassioned. These are just, every speaker is just so wonderful. Thank you for all these truths that you're bringing to us, quite frankly. So Marilyn, again, I know you have the questions, but I think, circling back to you after your very moving opening presentation and your amazing story, what are you seeing in terms of economic inequity from where you sit, in addition to anything you may not have mentioned, but during these times, like how is it, what do you want to say to that now?
I see it again. I see it every day. I work with women. My organization is led by formerly incarcerated women of color. And it's just like what Sandra said, we're not given the opportunity to have good jobs, even though we have the education, housing, all the things that a human being need is having human rights. We're not given that opportunity, especially women. And I agree with what Sandra said is, and I have to agree with her. I know from experience what she said, that we need more people to open doors, more support, alternatives to jails. Jail is not a solution to no one's problem. No one asks why a person killed someone. No one asks why a person stole something. No one asks why people are going to jail. There is an issue. It's not, you can't punish a problem. You got to fix the problem. there is an issue. So I'm thinking and knowing from the work that I do that we have to change the way of policing. We have to change the way we think as far as, oh, they broke in my car, I want them in jail. No, you need to figure out why they're breaking in your car. They're going to jail, but they're going to keep coming back doing the same thing. As I told the judge, you keep sending me to jail, I'm going to keep coming back. All I needed was a job that I could not hold because of crime I committed at 17. But there are same things happening. It's just like working to close down the city jail. People say, well, why are you closing the jail? People are in the jail, the Atlanta City Detention Center. They are there for traffic violations, sex work, not committing a felony or what I would say a misdemeanor. They are violating a city ordinance, which sometimes that traffic violation, they can't pay that fine. They go to jail, they lose their jobs, they lose their homes. Some women lose kids. It's a life sentence for barriers. It's a life sentence to be discriminated against. It's a life sentence to be told, no, you can't do this, you can't do that, you can't have this, you can't have that. And that is, it's a human right to have all the things that everybody else have. And I'm just, so happy to be a part of this panel, to be able to express that to another community of people that may have never even heard of this type of thing anyway. So yeah, so I'm just thinking there's alternatives. We need other alternatives. We need more mental health, physical health, drug addicted centers. There's people need therapy. Women basically are traumatized. We grow up as little girls as caretakers. We get up, we get to be a grown lady, we have babies, we see about our babies and get them off to school, we see about our husband and get him off to work, we go to work, we come back and we do that same thing. It's almost like everything is on the back of women except for them to deserve the resilience and the integrity and the proper title.
No, I couldn't agree more, Marilyn. Thank you. And COVID, if anything, has exacerbated that pressure on women in particular, the data is showing.
Yes. I also go into the prison system. I actually have two organizations. One goes into the prison system, where I go into the prison system and I teach employment development for women to be able to articulate your background to an employer, articulate the job that you do inside this prison, and you're the expert at it, because if you was there 20 years and you did it, you had someone with you every day telling you to do this right. And then we also give out gift cards, or what we call a welcome home package, because I know for myself, and the reason I give that out is there was times that I got out of jail, I went right in a store, out the jail into a store to steal, because I didn't have no money. I didn't even have a way home from jail. So today with my organization, when women get out of jail, they reach out to us, they get a $100 gift card, $50 for food, $50 for clothing, they get a 30-day model card, or they get a $20 gas card. We automatically give that to them just so they don't have to do what I had to do. They'll have a jump start to, be able to move about. We also house women coming from prison. And the hardest thing is to house is sex offender women. And people don't understand sex offender women. Okay, people don't understand that a woman may have a man and she's afraid of him, but when going to court, she's sentenced 20 years for allowing a cruelty that she didn't know was happening, or that was happening to her as well. So all of these things, come into play. People need to just be more compassionate, more supportive, and see what's really going on with the person.
No, amen to that. And I couldn't agree with you more. Compassion is definitely something we need more of in our society. And yeah, so I'm going to invite all of our panelists to come on video now. We're going to answer some of these questions that have been come in. So thank you, Marilyn. I may actually go ahead and start with you. And it's a question you did respond to saying in the chat, but let me see here. Where did it go? Apologies. besides housing, food pantries, and clothes closets, how can houses of worship assist with community and economic inequity in struggling families? So how can those houses of worship that are so important inside communities really potentially help out?
Again, you can reach out to family members that you know that are that have a low one inside, because when that low one inside, that family is inside too. You can also reach out to try to figure out who's coming out of the system and support them, support organizations that are supporting those folks. All the time, it's not monetary things that they need. Again, there's therapy, there's mental health, there's health care, all different types of things. People coming out of prison, they don't get health care. They don't get dentists, dental care, and they don't get any of that is proper. So those are some things that can help. A job, help with resumes, all type of things. It's unlimited to what you can help a person with. Sometimes it's just a conversation of inspiration.
Yeah. Well,
Maria,
today's definitely starting the conversation.
I wanted to respond to that question in addition to what Marilyn said, and those are all good ideas. The faith community churches can begin to get real about who's in their congregation. People who've been locked up and people who have had crimes perpetrated against them. And so sometimes what churches need to do is have the difficult dialogue that, yes, this happened, but there needs to be reconciliation, and that we have to be real that there is anger, fear, pain on both sides. And part of the role of the faith community can be that reconciliation. And the other thing that I want to applaud the faith community for doing with my organization for 33 years is partnering with us, providing buses so we can take kids to the prison, providing volunteer drivers, and other support. But I guess really what I'm saying is that somebody has got to say, we need to talk and have real talk about everything that's happening and how we sort of deal with all of it.
Yeah. And I'm going to add to that too, because sometimes, people say, well, we gave you a second chance, but it's not about a second chance. You don't know how many chances it takes for a person to get well. I went to prison 6 times because I just needed a job. Every time I got a job, I was terminated from it, and then I started back to doing what I'm doing. So sometimes it's not about, oh, I gave you a chance before and you messed it up. It's not about a second chance. It's about giving the people as many chances as it takes and as much support as they need.
No, I couldn't agree more. So I just want to give Erin and Ray an opportunity to answer. There's plenty of questions we haven't covered, but it's such an important piece, the network and the community. So Erin, Ray, did you have anything to add? At this point? Okay.
Yes, you're great.
Okay, thanks, Erin. Ray, did you have anything to add?
Yes, it's just one other thing. I actually was trying to answer it. I was trying to type an answer to someone who asked about, I didn't mention anything about any gaps, any gender gaps when you talk about unemployment. And, it's certainly, women are consistently, when you talk about unemployment rate, underemployment rate, and unemployment filings in Georgia, they're consistently higher than men. For a number of reasons, oftentimes, they are the ones who, whether they volunteer or have to, take family members, when things go wrong, particularly, recessions, pandemics, whatever, or any other period of time, they often take on, additional responsibilities that would pull them away from working in any other situation.
No, I completely agree. So, and I would just add, COVID is presenting, in my opinion, an opportunity for churches to step up in their leadership, not only to, of course, look and be honest about who's in their congregations or whatever it might be called, depending on the faith, but to really lead and develop communications, encourage compassion and volunteerism and generosity. And so many of them do, but it's terrible and devastating as COVID is and will likely continue to be for quite some time. People all should see this as an opportunity for real change and really addressing issues. So, and churches are in a unique position to do that and be a real leader, because it really does need to come from one's own community, that leadership and that gathering. I think resources like, you know, where Ray's at and Erin and others is very helpful too, but those communities and the people within those communities are so key to getting everyone around them to listen and be willing to get engaged and involved. So I'm going to pivot a bit because we have a bunch of questions here. Let me see here. I think this is going to be can you provide examples of Georgia employers who have done a good job in hiring returning citizens? Really to anybody, but Ray, since you brought up workforce first, I'll go backwards in the round robin. Do you have any examples of good employers? Not that you're necessarily endorsing them, I'll put the caveat.
I wish I did, but I don't have any examples that come to mind at the moment. You know,
Okay, Marilyn?
Okay, yes. There is, first of all, I am on the board of First Step Staffing, and that's what we do. We hire formerly incarcerated and homeless people. We don't just hire them, and we also find housing for them. And for some homeless people, we support them in applying for their benefits. There's Publix, Home Depot, Kroger, Walmart. Some of those places hire from returning citizens as well. And there's there's other places, I mean, that do. But I know off the top of my head, I know those two.
No, that's great. And I'm sure that, you know, we can follow up with some ideas if needed afterwards. And you know, Marilyn's been so gracious, and Erin and Sandra to be open to being connected with after this. So let's see here. Ray, can you talk about how unemployment and underemployment and how this may be gendered and the implications of the questions you're alluding to? The person would imagine Black women are more likely than Black men to be underemployed compared to unemployed, excuse me. I think you saw this question in the chat. I just wanted to see if you had anything to add.
That's the one that I spoke of, you know, when we first started addressing questions. But yes, you know, just to end it, you know, unemployment, underemployment, you know, unemployment filings, you know, in Georgia, year after year, consistently, almost every year, women outnumber men when it comes to the share of you know, employment, underemployment, and unemployment insurance filings.
Great, no, thank you. Erin, we have a couple questions for you. So when you say 30% of cancer patients are scared to come in, is that scared of catching COVID or scared of finding out they have cancer? And I have a follow-up to you after that.
That is a fear coming into a clinic for a screening because of COVID, because their exposures to COVID. So we are working on ways to do some messaging jointly here to kind of encourage for people to understand the process and know how, you know, they're taking, some of them are still doing questionnaires or taking, you know, temperatures as people come in the door, and work jointly, I think, as a healthcare community to encourage people to come on in.
Mm-hmm. So and I think you see the follow-up question in the chat, but any suggestions on how partnerships can address the issue of that fear and those who've gone untreated because they're afraid to visit a hospital?
Like I said, we're working jointly. I think our local partners are doing a good job. They're making the phone calls, you know, to each and every person that has not come for their screening. They're sending out postcards. They're doing a variety of things to educate the community about their efforts to prevent spread. But I think just having that, you know, that one-on-one call is probably the thing that we're getting the most response from, because we're able to have that dialogue. We're able to ease their fears. We're able to, you know, say, hey, we'll meet you at the front door, you know, that kind of thing. So far that has been the most impactful thing that we've done. I saw Arlene asking.
No. Yeah.
Okay.
No, that's great. And I apologize for coming to the chat. So I'm trying to organize the questions in some semblance of an order. Okay, so this is a little different, and I think this can be posed really to anyone. How do we find out how to motivate youth to, say, sell water in the community, but leave it littered with their discarded products? We appreciate entrepreneurship, but it's not necessarily the most responsible approach, especially the aftermath.
I'd like to respond to that, if it's okay.
Yeah.
Part of what Foreverfamily does is youth development, and we have a young entrepreneurs program. And one of the things that we learned is people do better when they know better. And so part of what young people need when they have this great, bright idea is adults and other peers supporting them and talking about the unintended consequences of if you distribute water and you don't have a plan for how you'll take care of the empty packaging in the boxes and the empty bottles, there'll be litter. It's my feeling after working with over 35,000 young people who have a parent in prison, they're like every other kid, they're normal. And I think young people want to contribute to our society, but they need to be mentored and supported as they do that.
Mm-hmm. No, and thank you, Sandra and Marilyn, for dropping some of those resources too into the chat for the community. Marilyn may want to repost yours to the whole community. I think it just went to panelists. So I think we're going to shift a little bit to some healthcare policy here. So this, Ray, a lot of this might fall into your bandwidth too. So what can citizens do to encourage policymakers to begin to expand data and their metrics to reflect the true impact?
Well, I think, first thing first, for, you certainly, should write and reach out and call your legislators, from the state and federal level to let them know, that you have, that they have, voters out here who want to see this information. And beyond that, to where, they're crafting policy that requires that, when they're addressing, economic situations, even when we think of like the highest level, twice a year, the chairman of the Federal Reserve, goes in front of Congress and talks about, the health of the labor market and talks about these different metrics, like the unemployment rate, but only talks about, the overall unemployment rate and what can be done to address that and to, to improve recession level. We should have it to where it's required, when they address Congress, or just, when any other, agency executives, are addressing legislators that they should, talk about not just overall rates, but they should disaggregate that because, when we're thinking about, this like, unemployment rate or unemployment benefits in every state, and, they all, come with a limit. Like Georgia right now, we're allowed to, people are allowed to get up to 26 weeks of unemployment pay right now. It was extended to 26 weeks during this pandemic. Before that, it was a number of weeks, less than, I believe it was 13. But when you talk about, there's also a thing called extended benefits, where if the state meets a certain trigger to where the unemployment rate is, consistently at a certain, recession level, then unemployment pay, the weeks of unemployment pay that people can get can be extended by, I believe, another 13 weeks. But that's all rested on the idea that looking at the overall unemployment rate. When the overall unemployment rate gets, to a point where they don't believe, it's consistently at a recession level, then, these extended benefits that people could get, they're discontinued. Even if, the unemployment rate, when you disaggregate it across race, it still could be high, as we see, in the the Black unemployment rate, is always, higher than, the overall unemployment rate. So I say all that to say that, we should write, we should call, and notify our legislators in every way possible to say, hey, you need to make this, it needs to be a requirement, to where, when you're talking about it, with, other economists that address you in Congress or in the state legislature, that they have to disaggregate that data when we're speaking about it. And we have to talk about it. So how do we improve it? Not just from an overall standpoint, but from, every segment, every demographic that's being affected by it.
That's helpful. So I think I got two last questions, and this was directed to Ray or Marilyn. The two halves don't make a whole. Which component of the ratio has potential for linkage to healthcare coverage? I don't have it. Does that make sense to you? Apologies, I don't have the original question in front of me.
Yeah, could you repeat that one more time?
Yeah, I'm trying to understand. And Robin, please chime in here if I didn't get the whole question from you on that. I think this is referring to full policies. Are there policies, legislation that supports this work? And is there a list? Yeah, I think we need some clarification on that. Sorry. Let's just, if someone did ask that question, they're still on, you want to restate it, please let me know. So this will be to the community and to the full panel, and this could be something we also follow up with attendees. Are there policies or legislation that broadly support the work that people could potentially write into their legislators about? And is there a list of community-based organizations that supports the work that can be shared outside of the ones that have already been stated? And this again could be a follow-up. So afterwards, anyone want to chime in on community-based organizations or specific legislation? And right now, I will say we're off session right now, so it could be. Marilyn, it looked like you were about to say something. No.
I was trying to clarify, is it around employment?
Yeah, we might have to follow up with that via email. I'm not entirely sure myself.
Okay.
So apologies for that. But Erin, you had something?
I was just going to say, I think this goes back to the discussion around just collaboration and making sure you're at many tables, you know, working with your family connections, working with statewide groups, you know, working on different things. You just have an opportunity to hear what others are talking about, what their priorities are, the work that they're engaged in, all around one table, basically, and then being able to take what you learned at that table to another table. And I think just this cross communication constantly is the way that that we're going to best see results and be able to communicate with legislators and just connect those resources. So.
No, that's great. And I would just affirm, you know, so many people think their voice doesn't matter, that their letter, their call doesn't matter. I can't tell you how many stories we hear about a legislator being completely unaware, or they didn't realize how much their people mattered, so cared about an issue. So, and it can come down to one more call versus, you know, if they had 25 calls on it and that was their threshold and they got 26, they were like, all right, I'm going to push for it. So everybody's voice matters. And on that note, there was one final comment about, you know, of course, this panel's been so informative and it trickles to the bottom, and we need to ensure that formerly incarcerated people vote. So this gets down to the get out the vote piece, not only for the broader public, but for this particular population. So does anyone want to make a comment on that? And then I'm going to invite everyone to make any closing comments.
Yeah, I will. Georgia Justice actually is working to put together some material for formerly incarcerated people to know their rights. It's called Know Your Rights. So they'll know their rights, that they can vote once they've delinquished all state obligations like fines, fees, and anything. It doesn't matter what you've been arrested for or what you were convicted for. Once you have completed all state obligations, you are able to vote. And so I know, and New Georgia Project also working with formerly incarcerated folks to make sure they know their rights and that they are eligible to vote, and actually doing some work around trying to put a voting machine inside Fulton County. So the folks that are just sitting in jail, that are arrested but not convicted yet, can still be able to vote. Like they don't know they can, but they can. So that is some work.
Thank you. And thank you, Sandra, for dropping that link in. No, thank you, Marilyn. That's outstanding. So with that, Marilyn, do you want to make any, well, we'll circle back and end with you. We'll have you do both ends of this. Okay, Robin, I have to find that question again in the chat. Sorry, guys, I'm being given questions now. Robin, do you want to ask it if you have it in front of you? Because I don't. I have to scroll back up and find it.
Question is for Erin. Just any recommendations you might have around minimizing health inequity?
You know, one of the things I didn't talk about really earlier was we talked about making sure that we tell our story and we come to legislators with solutions. But I think that the opposite is true when we go to communities, that we don't come with solutions with the community, we come with listening ears. And I think really asking the community what their issues are and how they think the best way to address that, and letting them be a part of that solution is the best thing. They're going to be much more engaged and much more invested in seeing that through. Everybody wants to belong. Everybody wants to be heard, as we just were talking about. So that would be my best recommendation.
Great, thank you. So with that, Ray, do you want to make any closing comments?
Oh, I just want to, thank all the other panelists with me to, that joined me today, in this, really important discussion. I'm glad to, once again, I'm thankful for the opportunity to be part of it today, and look forward to future discussions, whether I'm speaking on or listening, because these things need to be talked about. As we know, I appreciate you guys having this health equity series, because there's so many people that need to know not only what the gaps are, but the steps we can take to begin to address it.
Definitely. Thank you. Sandra?
Yeah, first of all, I didn't say this earlier, but I definitely want to say it now. I'm a board member for the Partnership for Southern Equity. And so, and I'm honored to be a board member, honored to be a part of what they're doing. And I'm gonna encourage everybody on this call, 100 and however many it is, if you have not joined PSE, you need to. And beyond that, I think all of us need to become and stay informed and do our part. What Ray can do, which was phenomenal with the stats and the data, that's not me. But what I've got to do is figure out what is my part, and I need to do that. And I think Erin actually a minute ago alluded to that, right? Listening to the community and all of that. So I just think each one of us has to figure out how to reach, if not a whole lot of folk, at least just one, to keep this conversation going. And I'm happy to have been a part of it.
Definitely. Thank you. Erin and then Marilyn.
Thank you. I just want to say thank you for having me today and the opportunity to talk about the things that I'm passionate about. Robin and I were discussing beforehand how when I first came into working in the cancer space, everywhere I went, I saw my same friends. Like, I mean, not the same people, but the people that we work with collectively across the state. And there's so many people that are on this call that I can see today that I work with in different capacities. And I am just so thankful for the team we have here in Georgia, all working together for this.
No, definitely. And Marilyn.
Okay, and me too. I ditto to everything that everyone said. I am excited to be a part of this, and I think the most important things that we can do is deeply listen to folks, support folks, and find alternatives to a solution instead of putting them down. Find the alternative to support and educate. Gotta educate folks. We have to educate folks. And so I think this has been a great way. I think I saw 100 and something people on the call from the beginning. So this is a great way to continue to educate people. You have to educate. You can't say it enough, and I can't express it enough, because that was how I was able to change 6 laws in the city of Atlanta, by educating, and making people see the difference from punishment to a solution.
No, that's great. And it's a great place to end. I will be a little self-serving before I shut down and say tomorrow one of my organizations is hosting a flu/COVID season, unfortunately, panel, and we're bringing in some experts from DC and the Immunization Action Coalition. So if anyone's interested in learning about how the next few months may play out and what people are projecting, I'd certainly invite anyone to join. It's free. It's a virtual program. Just drop that into the link. Additionally, Georgia Bio is working with patient advocacy groups around the state, plus some of our private partners, to put on the first ever Patient Advocacy Summit in September. So if anyone is involved or a patient or part of a patient group or wants to understand how they can have a voice, and also learn about, this will be kicking off a series of roundtables we'll be hosting for patient groups to connect with the innovators that are working to provide tools and treatments for patients on September 22nd. So I just wanted to put that to this group because it's a different audience, and especially Erin, with you being on this, I thought it might be valuable to mention that. But again, this was outstanding. Thank you all for joining us. This was, inspirational, affirming, troubling with some of the data, of course. But if anything, it allowed us to connect with more than 140 people today and begin that education process and make some steps forward. So with that, Robin, do I close this out or I turn it back to you?
I'll be glad to. Thank you, Maria. Thank you to all of our panelists, Marilyn, Sandra, Erin, Ray. Thank you all. Thank you for all the support from the PSC staff as well. And particularly thank you for all of you all out there who have hung in with us, especially with all of our little glitches. So we appreciate you. Our next event is September 24th. And we will certainly be getting back to you with information very soon. We'll also be following up with any resources and links that our panelists have shared. With that, continue to take care, wash your hands, wear a mask, watch your distance, and be safe. Take care. Have a great day, everyone.